Good morning. My name is Lily. I'm going to be your hygienist today and also your dentist. But we're just doing an inspection and a cleaning, so there's nothing to be nervous about. No needles or anything today. Yeah, well, and from what I can see already before I get my tools in your mouth, your teeth are beautiful, so yeah, well, I'm just going to start by taking a look at your teeth. Looking for, do you have any fillings that have been bothering you? Okay, no tooth pain that you've had thus far? Like since last time you were here? Yeah. Well, I know you've got a crown back here. It's looking really good. There hasn't been any movement or chipping of any kind. I am noticing that your back molars are a little less clean than the rest of your teeth, so those must be where you kind of struggle to brush properly. Right. Oh, that's pretty normal. But that's pretty normal, and some of it is just tartar, which is a little bit out of your control. So no need to worry about that. We'll just scrape that right off today. Okay. There's always a buildup of tartar around where our tongue is, like here and a lot right here. And that's because tartar is from the minerals in our mouth. That's different than plaque. And our tongue, has a lot of saliva, and that's where all the minerals are. And when you go to sleep and your tongue is resting in your mouth like that, it builds up. So I'm just going to do a little wiggle test, okay? I'm just going to gently wiggle each tooth. I like to check for loose teeth because sometimes we don't even realize. These are all very solid. And I wanted to check your crown and make sure that there's no movement there. Okay. Alright. So, I'm going to start with the scaling, which is, everybody's favorite part, I'm sure. I am going to be working a little hard on your two back molars and up front, but I'm very gentle and I avoid the gums. You let me know if you're feeling any pain, just raise your hand. And I'm just going to go in and see if I can't get some of this tartar off. I'm going to be really gentle around your gums. But that's where our tartar tends to build up. But just because this tooth is a crown now doesn't mean that we can avoid it in our hygiene routine, okay? Crowns can still degrade over time when they're not properly cared for. Be gentle right around here. Okay, that looks good. Okay. Plaque tends to, usually because people are generally pretty good at brushing their teeth, honestly, but most people are a little iffy on their flossing, mostly by virtue of the fact that they don't do it. So I'm going to be doing a lot of scraping between your teeth because your brushing habits are pretty good on all of these surfaces. But between your teeth, if you're not flossing regularly, there's some plaque buildup. But it's very minor. I don't see any real damage to your teeth, so. And a little bit along the gums just to get any tartar buildup. There we go. Along the gums gently. Has that been okay? I try to be really gentle. I know a lot of people hate that part, so I take my time and go kind of slow. Because I don't want to make anybody's gums bleed. I know that a lot of dentists kind of check that and like, hey, your gums are bleeding, you're not flossing enough. But I can tell about flossing without hurting you in any way. Okay, so I'm going to get really into right here on our teeth. A little bit right here too, but mostly right here where our tongue is resting in our sleep. There's a great deal of tartar buildup. And it's just mineral deposits. It's difficult to get through brushing and flossing yourself. So don't worry about it. That's what we're here for, okay? It builds up right here along the gums. Requires a little bit of work. But I'm being really careful. Okay. Moving on, we'll just get in between your teeth a little bit to finish the bottom row so we can move on to the top. And then I always have to do quite a bit of scraping right furthest back molars. Go along the gums just a little bit, super gently. I'm just going to use this scrapier scaling tool to try and get the plaque off of here. Get in between. Okay. Don't want to miss the front here. It looks really good. Usually people do a really good job getting the fronts of their teeth. It's the backs of teeth that people tend to neglect a little bit more. So, okay. Let's go ahead and do up now. We'll be working on between the teeth here. Oddly enough, your upper teeth look really good, which means that you are trying really hard to do the uppers. Just make sure you're doing as much effort on your lowers here. That's why you have a crown on this back one, is it's not getting as much. Just going along the gums again. Let me know if I'm hurting you at all. There we go. It looks really good up here. Okay. Grab my... Where did I put it? Oh, there it is. Just for the fronts right here near the gums. You're doing really good. Okay. There, and then we've got a little bit of tartar. Let me see if I can. There we go. There. Just working on the tartar. Moving over. I'm gonna just steady myself here with here. There we go. Just right here by the gums, if you could be brushing a little closer, would help with the tartar control, but again, that's what we're here for. It's helping you out with that. There we go. Okay. But the rest of your, like your molars up here and everything look fabulous. Barely anything to scratch off. Just a little between the teeth. Make sure I get behind. That can be a really hard place to get. It's behind that last molar. Okay. I think that we've got all of your plaque and tartar, especially right there. I'm gonna go under your lips now and pushing your cheeks back. Okay. Okay. Right in there. Oh. Got just a little bit that I missed right here between your two teeth. Back molars. I just want to make sure that I don't leave you with anything. Well, I don't leave you with any plaque. I will leave you with a toothbrush and dental floss. I'm just going to push your cheek out a little bit, okay? There's a pretty wide gap in between your back two molars, which is going to allow for a lot of food to get lodged in there. Right now, everything looks good. There's no decay, so you're probably doing a good job with your flossing on that tooth. Or the gap happened recently. It kind of almost looks like there was a little bit of damage to the tooth back then. So you're going to need to make special efforts to make sure that you're cleaning that out every night, okay? There you go. Just finish my inspection here. Everything else is looking very good. Just a tiny bit more on this back molar. Well, you know, they're the ones we chew our food on, so it's really no wonder that they need a little extra cleaning. Okay, I would like to give you a quick brushing lesson here, and I know that seems a little bit condescending, but I wanted an excuse to use my comically large toothbrush just to show you kind of how to be getting the spots that you're kind of missing in here. So, general rule of thumb is that we spend about 30 seconds on each quadrant of our mouth, okay? That means that you need to be brushing all surfaces of it. So you're going to want to get up under your cheek like this, okay? And be about 10 seconds doing this quadrant. about 10 seconds. Well, so this quadrant and then this plane, okay? So, like that. And then we do a biting plane, okay? And then this is the part that some people miss, although you're quite good at it. You go up inside your mouth like this and make sure that you're getting on the inside, okay? So then we move on to the other quadrant. Do the same thing, up under the cheek. And at home you won't be using this large of a toothbrush probably. This is, like I said, comically large. And then up here. And make sure that when you're doing this brushing, you're getting up here at the gum level, okay? You won't be brushing your gums. Same thing with the bottom, okay? Up under the cheek. 10 seconds per plane. Biting plane. Just like that, okay? Obviously longer than I'm doing it for, because your teeth are already clean in that way. So that's what we're going for, okay? I'm also going to do a quick floss, because even with my pick I wasn't getting everything, and for some people the dentist is the only time that they get floss. Okay? And I like to try to get back behind my back molar, okay? And kind of scrape it like this. Okay. Using those picks is okay, the little flossy picks. It's fine if you don't like doing this, but I will warn that because those picks don't have very much surface area, because when you are doing floss like this yourself, you're changing places as the floss wears down. With one of the picky things, you're using, old floss with food on it while you're doing it. Okay, these ones can be really tricky to get back into. People tend to really struggle with the top of their mouth more. Okay. Start right here. Okay, and right back here. Okay. I'm honestly not very great at flossing myself. Horrible thing to admit, but that would be why I have a lot of cavities. It's something I've gotten a lot better at, but I always feel a little hypocritical when I'm telling my patients to floss more. Okay, I'm just going to do a quick polish. We don't have an electric polisher today, so we're using a manual one. It's just some gentle it's a special material that polishes the teeth very similarly to our electric one, but and then I will give you some fluoride before I let you go. Okay. Want to make sure that we get this area really well. It's prone to tartar. Polish is really just kind of a final cleaning step. And not as necessary honestly on teeth that are as nice as yours. It always feels really crummy to come to the dentist and know you take pretty good care of your teeth and have them tell you, well, you should be doing this and you should be doing that. But, you know, we gotta tell you some way to improve. But if you didn't improve at all, you'd be fine. Your teeth look great. I want to make sure that I polish the bite surface. Those. And go in and do the last over here. Okay. And the bite surface. And the inner surface. Okay. Trying to get back there. There we go. Okay. That's great. I'm gonna put that fluoride stuff on your on for you now. I know it's not the most pleasant, but you can eat cold, soft food. Okay? Nothing crunchy or hot. Definitely not something crunchy and hot. So you better not have a Crunch Wrap Supreme. Get the front teeth right here. And make sure we get the inside. It tastes terrible, I know. The look on your face. I don't know why we don't make it in a more pleasant flavor. But I think that fluoride has kind of a taste to it, and it's not the best taste ever. I always try to really get into the between the teeth space when I do the fluoride, because people really need it there. And then I really like to get back behind their last molar. Okay, bottom done. That. We get the bite surface. Here we go. We really heat this stuff on. We have a hope that it stays adhered to your teeth for at least 4 hours, but we know better than to get our hopes up like that. If you want to take protection like this into your own hands, those fluoride rinses are actually really quite good. The Act ones. Here we are. Okay, what did I say about food? No crunchy, no hot. Okay. Okay. Well, your teeth look fabulous, so I'll see you again in 6 months, and hopefully there won't be any problems then either.